So resistant hypertension is a hypertension that is not controlled with 3 or more medications, including a diuretic, which is a water pill. We don't know exactly what causes it. There's a multi-genes that can be responsible for resistant hypertension, but we do know that patients who have resistant hypertension are more likely to have an identifiable cause. So in 20% of those patients, there is a cause that we can define and therefore treat accordingly. It's diagnosed by accurate measurement of blood pressure and taking a thorough history and physical exam. Most of the problems that we deal with in these days is that patients rush to the office when their blood pressure is determined, and sometimes that blood pressure is not accurately reflecting what the blood pressure is. So we reinforce different measurements, and we are now in the last few years encouraging to determine blood pressure at home, which is more important than whatever reading we get in the office. It is estimated now that 100 million of people in the US have hypertension, and about approximately a fourth of that, that's 20 to 25 million people, have resistant hypertension. So those patients are at higher risk. So it's important to define that population and aggressively treat them. The treatment options, and this is what we do in the Hypertension Center here at Hopkins, is to first of all personalize care of these patients and try to educate the patient first, try to modify habits and lifestyle, and then combine drugs that are appropriate for that specific patient. So in our Hypertension Center, we are a multidisciplinary center with people who are really obsessive compulsive about treating and managing hypertension. And we are now not only educating people and providing information on how to measure blood pressure and what lifestyle modifications they do, we do some non-invasive testings, such as measuring central aortic pressure, which is the pressure closest to the heart and to the brain, which sometimes in certain patients do not reflect the pressure in the arm that we routinely measure. And we are also doing something that is very new. We are doing a saliva or blood sample of genes, and based on those genes, we target the treatment. So to give you an example, there are certain patients who are more responsive to medication A or B, and we are able to tell that by doing a genetic profile of those patients, something very new and something that in Europe has been going on for a few years now. Last year, in 2017, the American College of Cardiology and the American Heart Association got together and decided to update our hypertension guidelines. And this created a little bit of confusion among physicians and as well as patients. And this is because what before we would call hypertensive, that patient who would have a higher number, a number above 140/90. And now we drop the bar to 130/80, meaning that having normal blood pressure remains the same. If you have a 120/80 or less, your blood pressure is considered normal. But now, if you have 130/80 or more, then you are hypertensive.